Moving on to the next session, we are pleased to welcome His Excellency Professor Dr. Zaw Wai Soe from Union Ministry of Education and Health, National Unity Government of the Republic of Myanmar, to give the inspirational message for this forum. Professor Zhao.
Good morning, ladies and gentlemen. Good morning, Mingalaba, Mingalaba.
Mingalaba.
Good morning.
I would like to thank Professor Dr. Mustaruddin Mansuras, Director of Southeast Asian Minister of Education Organization, Regional Center for Food and Nutrition for inviting me to this Learning Exchange Forum on Southeast Asian Early Childhood Development Promotion. I also convey my special thanks to Dr. Zarapat Chapichit, Deputy Director of Program and Development, SEAMEO Secretariat, for your warm welcome. Thanks to all SEAMEO Center directors and representatives from relevant ministries of the countries participating in this forum. We all agree that the prospect of a nation depends on how children are raised to be healthy, happy, protected, educated, and well developed. The first 1,000 days of a child life, starting from the time of conception to their second birthday, is the critical window period for their future health, well-being, and success. Proper nutrition during this period is fundamental on a child's ability to grow and learn, hence consequently being able to benefit society. Likewise, investing in the later part of the childhood is also important, as infection and malnutrition during this period can impair growth and increase mortality. Myanmar is a country with one of the highest number of under 5 mortality rate at 50 per 1,000 live births. Among children under the age of 5 in Myanmar, more than a quarter of them are stunted. Therefore, early childhood care and development in principle is a national priority, and so the Union of Myanmar adopted the policy of early childhood care and development in 2014. There have been many achievements under the democratic government, NLD government, between 2016 and 2020. Examples include, firstly, the setting up of multi-sectorial national action plan on nutrition, and secondly, the increase in coverage of childhood immunization with more than 80% of panther coverage in 2017. Thirdly, scaling up of early childhood development intervention as integrated package into existing maternal and child health services. And finally, the development of first ever national WASH strategy with investment plan. However, these developments have turned upside down after the unlawful military coup on 1st of February 2021. 80% of the civil servants joined the civil disobedience movement to resist the military and hinder their operational system. People like me, healthcare workers who resist the military, have been brutally targeted. I was forced to leave my house and my profession, but I'm luckily enough to be speaking today. Many have given their lives resisting the military. Over the 18 months after the coup, more than 2,000 people have been killed, including 42 healthcare workers and teachers, and at least 382 children being killed by the brutal military junta. More than 415 attacks had been carried out to healthcare facilities by military and prevented us from treating the patients. More than 1.2 million people, including 250,000 children, are internally displaced, requiring humanitarian assistance. The healthcare, education, and economic system of the countries are collapsing under the military council. Despite these horrific challenges, we, the National Unity Government of Myanmar, Ministry of Health and Ministry of Education, together with ethnic health and education organizations, are united. We have formed the National Health Committee and National Education Committee, providing healthcare services and education services online and on ground. In about 45% of the country area, services are provided discreetly in hiding using underground clinics, teleclinics, 24-hour telechannel for health, and also online and on-ground school for education, as well as by establishing 167 frontier hospitals and 51 secondary hospitals in regions where revolutionary forces have control. We are building 6 new hospitals with rehabilitation centers. Today, NUG and ethnic revolutionary organizations have more than 55% of territory control in Myanmar. The health services that I mentioned are made possible by the strong determination of healthcare workers on ground, medical diaspora around the world, and international community standing strong with us during this very difficult time. On a national scale, what we are providing is far from meeting the demand. The routine children immunization program, which has a good coverage previously, has now dropped to a worrying 30% coverage. This is a global health security concern. We have been negotiating and engaging with the development partner such as UNICEF, Gavi, but the military council has used medicine and vaccine as weapons in order to stop those organizations delivering medical supply to conflicted areas. Our policy is people first, transparency, and equivalence communication. We welcome the involvement of the independent third and fourth parties in the delivery and negotiation process of the vaccine acquisition. However, military did not comply. Due to the ongoing atrocities of the military council, the recent World Bank reported on Myanmar has projected that Myanmar economy is unlikely to return to pre-pandemic level, in contrast to the rest of the East Asia, with 40% of the population living in poverty. All dictators, all autocrats act in similar ways, having and using only one weapon, making people fear. We as medical professionals and education professionals have risen and will need to continue to rise unanimously and in solidarity against all dictatorship and autocracy causing instability. Going forward, Dr. Tedros' call of peace and stability are essential to better quality healthcare. Without it, better quality healthcare and better education. Without it, innocent people will continue to die. Although much has been discussed, the international system are still very weak to enforce peace and to make perpetrators accountable for their actions. The UN, the WHO, and the international community must do more. We must stand together. The children of Myanmar deserve peace, education, healthcare, nutrition, and their rights to vaccine, rights to immunization. I call all participating countries in this forum to advocate about the need for urgent humanitarian access, food security, and childhood immunization in Myanmar. The National Unity Government is committed to work with all partners, stakeholders, to save and improve the lives of our children in Myanmar and to build a better future where our people have democracy, health, education as basic human rights. Thank you so much for all your attention. Thank you. Thank you so much.
Thank you, Professor Dr. Zaw, for sharing the updates on condition in Myanmar. I hope everyone is staying safe in there, especially the children.